No one knows when they'll have an accident, and you can just hope you end up in good hands if you are seriously injured. Between Grand Rapids and Marquette, there is just one Level 2 trauma center, and it's at Munson Medical Center. As we learn in today's MedWatch, they are prepared to save lives at a moment's notice.
It was raining really hard that day, and he looked at me and he said, "Amanda, are you sure you're going to be able to drive in the rain?" And apparently what I said was, "I'll be fine." So, because you kind of don't know what I'm talking about.
Just a quarter of a mile later on M72, Amanda Laux lost control and a car behind her rear-ended her. This is what her car looked like 1 year ago.
It's hard, especially when I see photos of the car, because I remember waking up in the hospital, and besides this halo, I couldn't, people said, "Hey Amanda, you were in a car accident," and I remember thinking no, I wasn't.
That was 2 weeks after her crash. She had been in the intensive care unit.
I had broken several ribs. I had a hairline fracture on my pelvis, and I broke my C2 vertebrae in 2 places.
She also had a traumatic head injury.
When you have an accident that affects your brain, it actually affects a lot of things about you. It could affect your personality, it could affect your taste, it could affect your ability to walk or move. And that was one of the things about a broken C2 vertebrae, was it could have affected my ability to walk and to move and to breathe, definitely.
Amanda started and finished her care through Munson Medical Center's Trauma Center.
Traumatic injuries are never planned, and they're often quite severe for our patients. And it's important that the patients get the best care that they can, so they have an opportunity for complete recovery or restoring as much function as possible.
Munson has the only Level 2 trauma center in northern Michigan, and the American College of Surgeons just re-verified that status, that they are able to care for most any patient in an emergency.
I feel that the staff of this hospital have put their heart and soul into making this work. So I want to give them the credit that they're due as well, because they work hard to make this happen.
Amanda's journey from intensive care to today was not short nor easy.
I went to speech therapy, physical therapy, occupational therapy every day. And so every day I had to learn how to re-walk. I had to learn how to stand up and balance on my own, especially with this massive halo. It definitely makes you top heavy.
And she gives a lot of credit to the people who were there along the way.
I'm really gonna miss them, actually. They're good people. So they really cared about me. And I think, honestly, that's one of the reasons why I got so much better, is because they actually cared about me as a person and not just as a job.
For MedWatch, I'm Michelle Dunaway.